All right. Good afternoon, Dr. Abrams. Once again, we are ready for our afternoon chat, and today's topic is omegas. So, we want to learn about omegas from you. So, let's start with our first question. What are omega 3 fatty acids, and how do they relate to omega 6 fatty acids?
Fatty acids, unsaturated fats that we need for many functions in the human body. And fatty acids are divided into a number of different classes that are numbered, like 3, 6, 9, for example. The two big ones are omega-3 and omega-6. Omega-6 fatty acids are important because they promote inflammation. So if you cut yourself, you want your platelets, the particles that help the blood to clot, to adhere so that you stop bleeding. And you also want to get red, hot, tender, and swollen. That's inflammation. It's part of normal healing. And that's what omega-6 fatty acids do. Omega-3 fatty acids, on the other hand, are anti-inflammatory. So they cause platelet clots to break up, and they also are against inflammation. Now, in our diet, because these fatty acids generally come from food, in the old days, reportedly, and we don't have any way of checking this, the standard American diet before it became heavily processed foods and garbage, if you will, had a ratio of omega-6 to omega-3 in food of about 2 to 1. And people predict that nowadays it's up to about 18 to 1. One thing that's changed in the ratio is how we raise our food. So we feed animals products that they cannot utilize well. And so instead of making fat that's rich in omega-3 fats, they make fat rich in omega-6 that promote inflammation. And that would be commercially raised meat, poultry, dairy, and even eggs, particularly the yolks. Also, some nuts and seeds and vegetable oils, corn, safflower, and soy oils, are also rich sources of omega-6 fats. And again, these are promoting inflammation. And for people with cancer, we feel that they may foster tumor growth and progression. They also may allow new blood vessels to form to supply a cancer with more blood to grow bigger. Omega-3 fats, on the other hand, are found in deep cold water fish. So salmon, black cod, albacore tuna, herring, mackerel, and sardines. And they're also more highly present in meat that's grass-fed and poultry, dairy, and eggs that come from animals that are eating food that they're supposed to eat. And there are some small amounts of omega-3 fatty acids in canola oil, walnuts, and some of the leafy greens.
Just for our education, omega 3s and the context of the words EPA or DHA, are they connected? Are they linked?
Yeah. So the major forms of omega-3 fatty acids are alpha-linolenic acid, which mainly comes from plants, flax, for example, hemp, chia seeds, and some nuts. And then the omega-3 fatty acids, EPA and DHA, which are abbreviations for long words that just tell you how many something there are in those amino acids. Those are more commonly found in fish. And again, these compounds are felt for cancer patients to inhibit tumor growth and to be against new blood vessel formation. So certainly omega-3s are something that we want to boost. And the way to do that, because our diets are, perhaps we're not going to always eat fish every day, is to take an omega-3 supplement. Omega-9 fatty acids are neutral, and olive oil is a great source of omega-9 fatty acids. So I see a lot of my patients who are buying a supplement that's omega-3, 6, 9. I say, no, you just want the omega-3s in the supplement because you get enough 6, which promotes inflammation from eating foods that we generally are buying in restaurants or processed in fast foods.
What is the evidence that omega 3 fatty acids are of benefits for people in general as well as for people with cancer? Can you share some thoughts?
Yeah, omega-3 fatty acids are useful for many bodily functions. We often think of cardiac issues, heart disease. Uh, it's felt that omega-3s can lower triglycerides and increase HDL cholesterol, the good cholesterol. And that presumably would lead to decreased heart attacks. Now, unfortunately, most of the clinical trials looking at that have not proven to be positive. Probably the biggest trial most recently conducted was called the VITAL trial because they're looking at vitamin D, omega-3, both or neither. 25,000 people in this study conducted by Harvard investigators. And the primary endpoint of the study was death from heart disease or cancer. And the articles on both vitamin D and omega-3s were published in the New England Journal of Medicine a number of years ago, and they were both negative studies. However, vitamin D supplementation did decrease the risk of death from a number of cancers, and that's important to me as an oncologist. And omega-3s, although they didn't decrease death from heart disease or cancer, the overall endpoint, they caused a 50% reduction in heart attacks, and I'm sorry, a 25% reduction in heart attacks and a 50% reduction in fatal heart attacks. So even though the primary endpoint of the study was not met, I think it was not a negative study, and that's why I'm happy to recommend omega-3 fatty acids to my patients. Now, omega-3s are also anti-inflammatory, and we believe that inflammation is the cause of many of the degenerative diseases of aging, dementia, heart disease, and cancer. So decreasing inflammation, particularly if you don't have a diet that promotes anti-inflammatory activities, is an important thing. Omega-3s may also have some antidepressant activity because they do work on the brain. And certainly many of my cancer patients are dealing a little bit with depression, reactive, of course, to their diagnosis. So there are two studies that I like to tell my cancer patients about with regards to omega-3. Both of them are small, and one of them was not randomized at all, but it was a study in patients with non-small cell lung cancer. And one group were taking omega-3 fatty acids while they were getting chemotherapy, and the other group wasn't. Again, it wasn't randomly assigned, so there could be other differences between the groups. The patients taking the omega-3 fatty acids were able to get more chemotherapy and seemed to have better outcomes with regards to their tumor shrinking and perhaps longer survival. But again, it wasn't randomized and it was a very small study. Investigators at UCLA did a study in men with prostate cancer who were going to have their prostates removed. One group got a low-fat diet, 10% of calories from fat, and got omega-3 supplementation. The other group got the standard American diet, which is 40% calories from fat and no omega-3s. And the food was prepared and delivered by chefs at UCLA. And at the end of the 6 weeks, when the prostates were removed, the men on the low-fat omega-3 supplemented diet had smaller prostates, less cancer, less aggressive cancer, and their blood inhibited prostate cancer cells in the test tube more than the men in the other group. So I'm happy with omega-3s for patients with cancer.
Let's talk about risks. So starting with, are there any types of cancer where you have particular concerns about omega-3?
So my oncology colleagues, particularly those who deal with patients with hematologic malignancies, are concerned that omega-3s, because of their activity breaking up platelet clots, may make people with a tendency to bleed more. But I think the dose of omega-3 that you need to take for that to happen is about 4 grams, which is more than I usually recommend. 4 grams of omega-3 is something that Dr. Weil recommended in his book, Spontaneous Happiness, which is about how he treated his depression. And in Ayurveda, the medicine of India, omega-3s, I believe, are felt to be a bowel lubricant. And for people taking 4 grams of omega-3, I think it is a bowel lubricant. One thing that people taking omega-3s don't like is often the taste of it, particularly if it's a liquid. Even if it's a capsule, they're sort of big capsules usually. And I tell patients if you keep it in the refrigerator and eat food on top of it, that decreases fishy burps, which are often somebody's concern that patients express on taking omega-3 fatty acids.
So what is the typical dose of omega-3 that you recommend? 4 grams is clearly could be too much for people, but what is the dose that you recommend?
Yeah, maybe 1 to 2 grams.
Any other risks or side effects that people should be worried about?
Not that I can think of.
All right. Well, thank you very much again for another educational session on omega-3s, and we look forward to our next session